Is it normal for a man's health to decline as he ages? Today, we're breaking down barriers, talking through all of the ins and outs of what happens to you as you age. Well, welcome. My name is Jess Goldoni, and I'm sitting here with Limitless Male medical provider Corri Stearnes. Welcome.
Thank you.
Thank you so much for joining me.
Glad to be here.
Why did you get into healthcare in general?
I got into healthcare and just in general, actually, because my son has a medical condition, and I felt like I could not be the best mom and advocate for him if I didn't know enough. So that's what drove me into it.
Interesting. Was this your first career choice, or was this
second?
Second.
Yeah.
What did you start out with?
I did in-home daycare.
Very nice. Yeah. So how long have you been a provider?
I have been a nurse practitioner for 7 years now. Before that, I was a nurse for 10 years.
So 17 years in total. Mm-hmm. Almost 2 decades.
Yes.
It's fantastic. So what drew you to Limitless Male?
Actually, I met the owner and had a conversation with him, and his enthusiasm is really what drew me to the company. Like how enthusiastic he was about what we provide to the patients and what we do for the patients made me want to be a part of the team.
And what do you think sets Limitless apart? Like, what do you think we provide to the patients when you say that?
I think what we do better than anyone else is the fact that we do an individualized treatment plan. It's not a one-size-fits-all treatment. We look at your labs. We do a full lab panel looking at your blood counts, your kidney liver function, your thyroid function, your PSA, your testosterone, your estrogen, and we make sure you're healthy before we start you. That there's nothing else that would contraindicate starting testosterone replacement therapy or any other therapies we have. And then we tailor that program based on your labs, your signs and symptoms, and how you feel and your needs.
So why do you think that there was a need for something specialized like Limitless? I mean, wouldn't a normal person think that primary care, like your regular, doc in a box or your primary care guy could help out a man?
Most people would think that a primary care can, but when you think of primary care, they have to think of a bunch of things. They don't specialize in one thing like we do. They have to know a lot of things, but when they know a lot of things, they can't know a lot about one certain thing. So that's not what they do every day, all day long like we do. And a lot of times when I've gotten guys come in that have started treatment at their primary care, have said that they're doing their testosterone every 2 weeks. Well, the half-life of that medication, they're having roller coaster swings in their emotions as opposed to feeling good all the time, just because of the way the medication works. And they're also not being treated with the other 2 medications that prevent the side effects, which helps your estrogen level stay in check. And also with the Clomid to make sure that we're helping with the fertility and the testicular shrinkage. They're not doing those treatments as well along with their testosterone.
So it really is, like you said, it's a breadth of knowledge, not a depth of knowledge when you go to a primary care.
Yes.
And I would say that they did the same thing with women's health in terms of you now have special hormone specialists and women's focused healthcare for a lot longer. It's been around a lot longer than it has for men because of that difference.
Yes. And any medical provider will tell you in school, like you'll probably have a paragraph or 2 about men's health, and the rest you'll have a whole semester on women's health. Really? Mm-hmm.
Do you think that's changing, or why do you think that is?
I think it might change. I haven't looked at programs lately. I would hope it's changing and becoming more equal. Honestly, I don't know why they didn't. I don't think they knew too much to think about it. I mean, even guys that come in now with like these symptoms, they say, and even their primary cares have told them, like, that's just getting old. That's how you feel. That's what happens, And with the ED symptoms, they tell them all the time, like, that comes with age. You just got to deal with it.
Suck it up.
Yeah. And you don't have to do that.
I can't imagine getting told that all the time. I mean, I know that women have to go through hoops and we have to advocate for ourselves as well. I don't think that men are definitely used to that.
Definitely.
But getting told, suck it up or rub dirt on it, I mean, that's got to be pretty demoralizing to a guy. What do you think that really, they have to be so strong. They have to be so masculine. Do you think there's Like, how do we get around that? What do you think that we need to do?
You hear it a lot from the guys too when they come in there, that they like, it was hard for them to come. They weren't going to come, but they felt like it was their last effort to feel better, you know, because they went to their doctor and they were told that that's just how it is, and they weren't going to do it. And then watching the commercials on TV is really what drove them in, saying, I'm just going to try this last ditch effort and see if I can feel better. And I mean, to me, that's kind of sad that you can't go to your primary and either get referred on if they don't know, because it's okay as a medical provider to say you don't know something, like that's not your specialty, and send them on to someone that is a specialty. You do it with cardiology, you do it with endocrinology, you do it with so many other specialties.
Right.
Like, it's okay to do that. And you feel bad when you see it in their face, like how beat down they are, but it's good to see the change.
Right. So take me through that moment as far as, what do you think is that, you said that they kind of lose all hope and they're like, all right, I got to try something, or, you know, something in my life is going to break if I don't get help. Like, what do you think is that trigger that gets guys to actually be like, okay, fine, I need it. I need help. Is there relationships? Is it like, do you have any, you know, examples of something where a patient, you know, it was a last ditch effort?
Yeah. The majority of the time it's their wives. The majority of the time. Tell them they need to get help. They need to figure out what's going on. It's affecting their marriage. I've had many guys tell me that. There was one guy I remember that was on treatment, then had some cardiac issues and had to stop treatment. And like, before then, him and his wife were having issues. He was on treatment, was getting better, felt better, was doing so much better. Their relationship was better, and then had to stop because of the cardiac issues. Well, then his cardiologist did more research and found out that testosterone is actually cardioprotective. It's not actually going to hurt you. So his cardiologist allowed him to come back, and I remember him being in tears. Like, I have to save my marriage. I need to start treatment again and get back to feeling better. Like, those kind of things, like, they give me chills, and they also, like, it's hard to not cry with them, you know, and sometimes I have, but just because I'm an emotional person. But yeah, it's so rewarding to see them get on treatment and feel so much better, and hear that they've saved families just by starting treatment.
I can't imagine. I would probably get emotional too, just because you're seeing someone that was really at the end of their rope, and it sounds like he was so grateful.
Yes, definitely. He was. He, you know, we have to do the labs to make sure you're healthy before we can start you. So we can't ever start you that first day. But he really wanted to start that first day. And I had to remind him why we couldn't. We had to check everything. We had to get the labs back. But I told him I'd call him as soon as, you know, they came back and we can get him back in. But rather than waiting a week. But they feel so much better. Like,
do they open up to you? Like, when they come in and they're having a consultation, it sounds like you have a lot of stories. It sounds like you've heard a lot of life journeys. How open are they with you? Is it kind of hesitant at first and then you put them at ease, or how does that work?
Most guys are a little bit more hesitant. Some guys will tell you everything. Some things you don't want to hear, but most guys are pretty hesitant. But as you get to talking to them, and then like the relief on their face when they realize that we providers understand what they're going through and they aren't alone in this, like, it's a huge relief and like a big sigh, and you just see the weight come off their shoulders once they realize that, and then they start to open up more.
I think honestly that's the biggest thing, is changing the conversation from having this closeted disease, or like you said, it's just a symptom of aging. You just suck it up and just do it. Is that once they hear you say what you're experiencing is, it is normal.
Yes, it is normal.
It affects, you know, more than 60% of those over 40, hypogonadism. But not only is it, what?
It's treatable.
It's treatable. It's fixable. There's something you can do.
Yes.
What is that like? After you tell them there's something you can do, because guys like to solve problems. So when you give them that solution, how do they react?
Most guys, like I said, they kind of just act like you can see that weight come off their shoulders. Some guys are a little bit more skeptic still, trying to, you know, like, really, is it going to help me that much? Is it really going to make that big of a difference? But most of the time, that weight comes off their shoulders, and like they're all just like ready to start right away. But we have to wait till we get our labs to make sure we're safe. And, you know, and I always like to go in there that next week after they've gotten their first shot and ask them how they feel. Chances are they aren't feeling too much that first week, but some guys like, I feel a little more pep in my step, you know, and they're excited to start the journey.
How long does it take if they don't feel it in that first week? How long does it really take for them to feel better?
Each month you start to feel a little bit better, but to feel optimal effects, it's about 3 to 6 months to get that full effect. And sometimes it's gradual. So you got to really take a step back and think about what you were doing when you started. You know, you wanted to work out, but you weren't working out. Now, 3 months in, you're starting to actually go for walks with your wife at night or take your dog for a walk, you know, and then that 6-month period, you're starting to hit the gym, you know, and making gains in the gym. That's when you start, but you don't realize it because it's gradual. And some guys are like, I haven't noticed anything. But then once we start talking about things, they're like, oh yeah, okay, you're right. I'm a lot different person.
Interesting. And what do they notice? So you said energy. I mean, is that the biggest thing that you see that guys just finally, and that's maybe why they don't notice it. They're like, oh yeah, well, I got a good night's sleep. I'm good. Like, what are the improvements?
The biggest one I heard is I don't go home and just sit on the couch all night long. I go to my kids' t-ball games. I help coach now. Those are some of the big things that get guys really excited is when they start to help coach their kids' games. Or going for the walks, or, you know, just not going home and just having no energy and just sitting on the couch. They have time for their family. They have the energy to do the things they wanted to do with their family, to be the dad, be the husband they've always wanted to be.
Right. Gosh, that's interesting. It's also interesting. I know that sexual health is kind of obviously a large part of the practice as well, but there's definitely a stigma with sexual health, with the Viagras and everything else out there, but it genuinely improves lives.
It does.
What are some, I mean, when a guy comes in after having a successful treatment or getting on medication or having a pulse treatment or something like that, how does it improve their lives? I mean, obviously their wife is happier, but what else?
Well,
is it just pep in their step? Is it...
So anytime a guy has even one occurrence of ED, whether it's just they weren't able to achieve an erection or maintain the erection one time, it gets in their head and it's a big cycle. And then from there, that cycle of the mental aspect of it, it makes it worse because then, you know, a guy doesn't want to fail ever. None of us do. So then they start to avoid it. And then it really just impacts the relationship. So when we can give them the medication or do the pulse procedures to improve that so that they can have those erections and maintain those erections, that brings that confidence back. And then it totally improves their relationships.
It really is chicken and egg. I mean, we've all had some experiences with that in the past, and it's definitely something where, honestly, as a girl, as a woman, we don't really care. We don't judge on that.
Yeah.
I mean, I don't care. There's a lot more things that are on the menu than just one thing, for example. But we honestly don't care. So when we say it's not a big deal or it's not a problem or it happens to most guys, we're actually not lying. It's true. We don't care. But you're exactly right. It gets in their head. And then it's starting to come up every single time they're about to, you know, try for sexual activity.
Yeah. And they don't want to fail, so they avoid it. There are some men that have told me, though, when it happens, then their spouse thinks they're not in love with them anymore. And then that makes that mental part even worse because that's not what it's about. It's actually the function, the lack of blood flow that is causing it. And it's not the fact that they don't love their wife, their girlfriend, their partner.
I can definitely see that.
Yeah.
Because it is and especially as a woman, you're going to internalize that as a comment on you, or on something that you're doing, or maybe he's not attracted to me anymore or anything like that.
And that's the one thing that I feel like guys never actually brought up to me, but then I would ask them, like, is it in your head at all? Like, is anything going on in your head that's preventing you from that? And they said, I know. And I'll say it as, you know, sometimes, like, you know, us females can get a little crazy sometimes, you know. We can get in our own heads too and think that the fact that you aren't interested, you know. And he's like, and they'll like, oh, Yes. It's like happens all the time and a lot more than we think about.
How much, and I bet you've gotten very good at this, how much do you have to prompt men when you are asking them a straight question and they answer it a certain way? Like, no, I don't have a problem. And then you have to now ask it a different way. How often does that happen?
Very often. Especially when it comes to ED. If I just, generally when they get checked in, they'll ask, do you have any erectile dysfunction problems? They'll say no. So I'll just kind of start it. So you said you didn't have any erectile dysfunction, but then I'll ask some prompting questions like 10 out of 10 times, can you achieve an erection? 10 out of 10 times, can you maintain that erection? And then they might get into, well, maybe 8 out of 10 or something like that.
Right.
And then that conversation turns back to, but that's normal. That's what my doctor told me it was normal. But it doesn't have to be normal. And the sooner we fix it, the better chance you have of maintaining that erections for longer.
And who's normal?
Nobody.
Exactly. I mean, if that's what the doctor is saying, whose normal are you going off of?
Yeah.
And who wants to just be normal? Don't you want to enjoy it and have a positive experience all the time? I mean, and live your life to the fullest for sure.
Definitely.
I mean, I know that you have patients that maybe don't have severe ED that have still found help with, the daily medication, the daily troches, or pulse is preventative. I mean, I've heard of people that actually just come in for a pulse to make sure everything keeps working because it is actually a curative method. How many patients do you have that do something when they don't have a severe problem?
There's quite a few. Actually, I feel, if I really step back and think about it, I feel like probably at least 85% of our patients are on something, whether it's like the dailies, because the dailies, improve that blood flow, keep that blood flow going all day. They build up in your system to keep that blood flow going.
Right.
So that you can have it's not that you're going to walk around with erection all the time. It's just, it helps get that erection easier, faster, and longer. And then the other troches that we have, the Zeus, Thor, and Hercules, those are just, some guys like to use them just to maybe last a little bit longer, and they don't really necessarily need it for the ED.
Right.
But yes, pulse being preventative is huge. Not everybody realizes that. They think it's more for severe ED. But if we can open up if there's some vessels not opened all the way in there, we have less to get open. We can get those open better, and we can get you to 100% longer and easier. If we're 50% erections to 0 erections, we're not going to get them to 100% if we wait that long. So it's a lot better to start earlier rather than later.
Interesting, because that procedure is painless, the pulse procedure. It's radio sound waves, correct? Like radio frequency?
Yeah. It's the same machine that they use to break up kidney stones, but we use a lower frequency, so It's not as strong. And
so what it's doing is actually opening those blood vessels in the penile tissue.
Yes, it's breaking up the plaques within there to get them open. It can also cause little tiny micro abrasions, which anytime there's injury to the body wants to heal itself. And by doing that, it sends blood flow there and regenerates vessels.
Interesting. And back to the troches too. I know a lot of people, when you talk about blood flow, people are using it for workouts, for example.
The dailies.
And having that ability for your body just to work more efficiently, right?
Yes, because the medication doesn't just open up the vessels in the penis. It opens up the vessels throughout your whole body. So when you're working out and you've got more blood flow to all your muscles, you're going to have more gains in the gym. And many guys have said that they've seen huge improvements with that.
Do you think we're making progress as a human race or as a country on getting rid of this stigma around men's health? I mean, why does it always go to a dick clinic, or why does it always go that direction? Do you think that we're making changes?
I would like to think so. I think the more we normalize it, the more we talk about it, the more we can make that change. The more we ignore it and shove it under the rug, then we're not going to get anywhere.
Totally agreed. And I know that I'm approached when I'm out. I know that I'm approached by people in my circle. Even if we're at an event and we're talking to a guy, like, oh, yeah, you have low T, blah, blah, giving, crap to their friends. But then they'll come back around and then they'll ask you a question. It's like, well, why didn't you ask it in front of everyone else? But what I love is once they get treatment, they tell everybody.
Yeah, you should go there. You should go there. Yeah, but then they're just quiet about, like, it's just a guy admitting something's not right is the big thing, and they don't want to do that. Nobody does, you know.
Yeah.
And to say something is wrong with them when a man always feels like they have to be perfect and to be the protector is hard for them. So it's just getting them to admit that. It takes time.
Think about like a patient that you've had for a very long time. Obviously, you establish a relationship with them.
Mm-hmm.
How does their perspective change? You said that they're, you know, we talked about them being fans, but how does their perspective change on this as they've been a long time patient? Is it just, I've heard before, God, I don't know what I was thinking. I was, you know, sitting in the parking lot afraid.
Mm-hmm.
And if I could just talk to that guy, I would tell him you have nothing to be afraid of. This is normal, fixable. So what do you think that switch is? Is it just they see it's fixable?
When they start to feel better,
Mm-hmm.
I think the switch is when they start to finally notice that they weren't wrong in how they felt before, and that it wasn't, yeah, maybe it's considered normal because you're getting older, because your testosterone drops, but you don't have to live that way. And when they realize that, then they're like, God, I got to share this with my friends. I got to share this with my family. You know, nobody should have to feel this way. And nobody should have to sit there and think that this is just life anymore.
I had never thought of it that way before, because they've literally discovered almost that, yes, it wasn't a moral failing,
Mm-hmm.
that there was actually something wrong
Mm-hmm.
that they can fix. And then it becomes a problem that anybody can solve at that point.
Mm-hmm.
It's like your car's broken down. What do?
Yeah.
You fix it.
Yeah.
It's not the car's fault.
You got to keep the oil in it. You got to keep the gas in it. It's kind of the same thing. You got to keep the testosterone up in order to feel like you felt when you were younger.
Right. Or they just, a lot of guys will just resign. Like you said, this is aging. This is what I am.
Mm-hmm.
But then once they realize that they don't have to. I like that line that you said, as far as you don't have to live this way.
You don't.
That there's a different way. There's
Yeah.
a different thing you can do.
And so many guys, I tell all my coworkers they need to come here. And some of the guys will be like, their coworkers will say, I'm only like late 20s or early 30s or whatever. And he's like, it doesn't matter. Go get it checked. You never know. You never know. You have all the symptoms. And then they'll tell me, like, they're finally coming. Mm-hmm. So they get all excited when they get their coworkers or friends to come in.
Yeah. What does your family think about you working here at Limitless Male? And what does your significant other and...
I think at first he wasn't sure what I was going to be doing there. You know, everyone I think has a thought of what we do.
Mm-hmm.
It's probably not what most people think we do.
I'd agree with that.
We're doing a consultation, kind of like us sitting here together. We're doing lab draws. They're getting injections. We're doing vitals. That's 95% of what happens in our clinics. But as I started there and, you know, talked about the change in the men, that finally got my husband to go in too. So
Really?
Mm-hmm.
Just talking about some of the things that you'd seen and some of the experiences that you've had.
yes, and then comparing him to his symptoms as well.
How did that go for you? Because I'm having the same conversation on my side.
It took me a while because he does not like to take medicine. He will go for like his checkups and whatever, but he does not like to take medicine. But he is a huge fan of working out. So finally I said, just go for an initial. I won't be there. Somebody else will be there. Just go for an initial, get your labs done, you know, see what it is.
Yeah.
He did start the dailies for the workouts, and he said that is where he's seen the biggest improvement, being 50 and having to go to the gym. He hasn't seen this much muscle gain since he was younger. So
Your husband's 50?
yeah.
He would not look it.
No,
At all.
he doesn't.
That's great.
Mm-hmm.
I'm glad that he's found that extra oomph.
Yeah, now he's telling all his friends about it too.
Of course he is. We need to start a referral program.
I know. Yeah.
Here's a card.
Yeah.
Here's go see my friends over there.
Yeah.
So tell me about another patient. Is there anyone that sticks out to you? Is there any interesting story or somebody that you miss? Because you're not, having gone up in your career now, you're training other providers at Limitless. So you're, not in the clinics every single day. You're in very frequently. But who's somebody that you miss? What's a story you miss?
There's the one patient that I had where he came for his initial. And when he walked in, I was like, this guy doesn't need this. Because he was like this big muscle guy. And once he starts telling me his story, he was an professional bodybuilder. And so he told me his story. He used to do it illegally. And he wanted to come to us to do it the right way and be healthy, because it took him and his wife a long time to have a child. They spent a lot of money to have their child. And
IVF?
Yes. And his kid was very young at the time. And when he realized all the negative side effects of doing testosterone illegally and taking too much testosterone, he came to us because he wants to be there for the lifetime of his child and not just for a couple years. And he was scared if he continued to do what he was doing, he wouldn't be there very long. And so he had quit a couple months before he started with us. And I was shocked when I saw his testosterone level. It was the lowest I've ever seen this whole time I've been here.
Because he was also not taking Clomid or Nastrozole.
Yeah, he was taking nothing, just the testosterone and a very large dose. Like, I was shocked when he told me his dose. And then...
What were his levels at when he was doing it illegally?
He never had him tested because he was doing it illegally, so he wasn't getting him tested. But when he came to me, he had stopped for like 2 months, and his testosterone was like 27. And I was like, what?
And 300 is what insurance considers to be the normal range. The low normal range.
Yeah. And I was...
27.
So then he started with us, and he's doing treatment. He feels great now. And... we still talk, even though I'm not in the clinic. Him and I still talk, and he tells me all the stuff about taking his son to gymnastics and stuff. And yeah, he's much happier now. He feels better. I can just see it in his face. He's just so happy.
Yeah. So is that why testosterone gets a bad rap? Because they always think of it like a steroid, for example. So is that a whole underground culture?
Yes. So
why would somebody do that? Why would they take it illegally like that?
To get huge,
to build muscle, to get big,
to get very, very big. That's the main reason why guys take it for that. But it's not healthy. It's not safe. When your levels are that high, you can have the same symptoms as low T, the low libido, the fatigue, the irritability, the anger is worse when your levels are too high. You have more risks for thickening your blood, which puts you at risk for heart attack and stroke. I mean, it's not safe to have that high of a level. So that's why we keep the guys in a safe range, so that we know we're making them feel good, but we aren't putting them more at risk for those negative side effects.
Have you ever talked to any of the wives, any of the girlfriends? Do they ever come in?
Some do. Not a ton. There's a few where they came in every time. There was a couple where the wife comes in every single time, and she's the cutest little thing. But she was all for her husband getting treated because they hadn't had sex in like 3 years. And so they were ready for treatment.
As an understatement.
Yes, definitly.
And had success.
Yes, they did. They had success, and actually a pretty short time.
Older couple?
Yeah.
Okay.
Yeah.
Interesting. Yeah. So, we always say that, yes, we talk to the men, but it really is important to make sure that you're communicating with the spouse, the wife. And that's why, myself as a marketing person, I want to make sure that we're communicating with them and educating them, making them feel comfortable, because they make 83% of the medical decisions for their household. And nagging doesn't hurt. I hate that it's called nagging, but I first got with my husband, it was doctor, dentist. And it was, just making sure that the people that we care about will be there.
Yeah.
Basically. And that's the whole reason, to have these conversations and to be honest about things, because I didn't know a lot of the things that I've learned since I've worked there. And we're just sorely lacking education on men's health as a society in general.
Definitely. And having the wife be a support system is huge in that guy's life. Like if a wife is more supportive about him going and getting checked out, they're more likely to come, one, and likely stick with treatment. Also, just anytime someone is going through something in their life, like having some type of support system, so spouses doing that for each other is huge in helping someone feel better. And it's a journey they can take together, you know?
It's also the way to normalize it.
Yeah.
The more that we can talk about it and that we don't make it this big thing, like you said, we don't shove it under the rug and we don't make it a big thing. Mm-hmm. The more we can just make it like diabetes.
Yeah.
It's something that happens, unfortunately. Lifestyle can increase it, but it's also treatable, or at least you can maintain it.
And save marriages too. Like, you know, if you're fighting all the time because they're irritable because their testosterone's low, if we get their levels in normal and they're not so irritable, like they get along better. You have more fun together, besides having the energy to do other things too. But it just makes the overall family happier.
That's really interesting, because when you think about healthcare and diseases, the only time that you ever talk about something like that is depression, some mental health illness that affects your life, that once you get treatment or you get a diagnosis, it literally can change your day-to-day life. It's not like it's saving lives necessarily, but it is. You just said it's saving marriages.
And depression had a stigma forever too. And I mean, it still does, you know, but it's better. But still with low T, there still is that stigma. It's just the guys having something wrong with them and admitting that they have something wrong with them. It actually takes a strong man to actually come up and say, something's not right with me. I need help. It actually takes a strong man to do that.
I would agree. I would think that it's much more, it's stronger and more masculine, if that's what they've been trying to do by being stoic and being quiet and just suffering through it and just, you know, rubbing dirt on it, when in actuality coming forward and saying, hey, this isn't right and I'm not going to stand for it anymore and I'm not going to live like this and I'm going to fix it.
Yeah.
That's the stronger route. Takes more courage.
Definitely.
Yeah. And then seeing, like you've seen at the back end, just how much better they feel.
Oh yeah. They're much better. They're much happier. They come in there all cheery, talking about their week and their weekend and what they've done and how much better life is. Like it's so good to see a guy come from not wanting to walk in the door to being happy and cheery and talking about all their fun things that they've done and the things that they're doing now that they didn't used to do. It's really rewarding to see that.
Corri, this has been an absolute pleasure. Thank you so much for joining us here on this podcast. And more than that, thank you for being honest, you know, with this hard conversation. You know, we can't change things without starting to have these open conversations. And I know that our audience will really appreciate the information that you've given. It was a lot. It was a lot to absorb, and, you know, everything from symptoms and talking about your patients, and then talking about just what an initial consult is like when you come to a place like Limitless Male. So I know there was a lot of information, and I know that we will for sure put it all in the show notes so that everybody else can download it. Would you also commit to maybe coming back and having more conversations with us?
Of course.
Okay, great.
Well, thank you. Yeah, thank you for having me.
Thank you very much. We appreciate it very much. Thanks for joining us today. To book your consult at Limitless Male, check out the show notes, or you can get more information at limitlessmale.com.